9 years old girl. She got door crush injury. If you see over here, it is she presented after 4 weeks of trauma. Initially, it was undisplaced, but patient loss in follow-up and reported after displacement. There is crush injury, and initially it was managed at some other services. If you see over here now, there is proximal phalanx fracture with displacement of distal fragment dorsally and ulnar. So there is overlap around zero point 0.5 to 1 centimeter. Over here, only this tag is intact, so this neurovascular bundle probably based recovery is there. So this was the trauma scar all around circumferential. So this is totally healed, and this one is still in healing process or partially healed, but it's too long if we left it as such. There is gross deformity. She was unable to bend the EIP joint and to use the index finger for thumb purpose. So we have to intervene now. So this flap we have to spare it, and the old flap we have to utilize with extension of this one to the other side to explore the fracture area, and then we'll see what is there. Extensor and between the extensor and neurovascular bundle. Basically, we don't have any other option rather going through the same scar. To the dorsal side. Right. So you can go through the central slab, or you can go on either side, medial or lateral. You have to stay proximal to the extensor rod. Right now you are over the bone and there is callus formation. Be careful, this is very small bone, and be gentle and patient. Rotate in this way and then to turn it this way to deliver the this is how you reduce it. And now see, this is reduced. Or another. So this is how, be gentle, patient throughout the procedure. And reduce the deformity. I've been pulling from that side. Sponge grow. थोड़ा सा लेते हैं सर, टिप से लेते हैं साइड से, उधर ही जिधर मेरे को लगा हुआ है. चलो, so both rotation and angulation is corrected. छोड़ी जरा वहाँ से छोड़ो. So if you see over here, we put one wire from proximal to distal, and just to spare the PIP joint, and the other wire from distal to proximal, and this is well aligned fracture now. Lateral है साढ़े को? जी sir. So both the wires been crossing to each other, and it's sparing the joint. So we'll try to start the early rehabilitation to, you know. I can show you here. So this is well aligned. It was combinated on this side. So if I'm gonna move with the, you know, there is well fixed. There is no mobility at all. We'll try to start early range of motion, and we have to put the stitch in inverted position so that the knot shouldn't come in the area of scar, because there is already a little bit infection was there. Thank you. So every finger should go to the tubercle of the scaphoid. This is how you check the rotational alignment. Yes, sir.